Well, everyone, welcome back to a very exciting episode of the Storybox podcast. Today, my friends, I'm delighted to welcome the very renowned Stanford doctor and scientist. His name is Dr. J. Bhattacharya. Now, for those of you that somehow don't know who he is, instead of me gushing about all his wonderful work and what he's well known for, I'm going to ask Jay to do his own introduction for you all. So I'm going to spin it on Jay and ask Jay, who are you? And what do you do? Please take it away, my friend.
I'm a professor in the medical school at Stanford. Have been for the last 20 some years. I am in the Department of Health Policy. I have an MD and a PhD in economics, of all things. A research scientist. I have been studying infectious disease policy and epidemiology for a very long time. During the COVID pandemic, I took a stance that was at odds with many other people who were running public health policy against lockdowns, in favor of focused protection of vulnerable people, against school closures, against the kind of policies that I thought were not rooted in the scientific literature, really, and it was not, and I knew would cause harm to the poor, to vulnerable, to working class people. So I've been an outspoken advocate against those policies throughout the pandemic.
Welcome so much to the Storybox podcast today, Jay.
Thank you for having me, Jay. I really appreciate it.
It's great to have you here, really. And like you mentioned in your own introduction, you have been rather outspoken and you've taken a rather different stance on the whole COVID narrative, which was honestly rather crazy, especially here in Australia. I was in Sydney during both of the lockdowns, which I'm sure we'll get into what happened with those crazy ordeals a bit later. And I think it's a rather curious thing how the media had one particular side that they were pushing, and how these so-called epidemiologists and scientists were all in line with that same viewpoint. And then anyone that had a differing viewpoint, even if they were considered to be a professional, they were railed on, which I couldn't understand for the life of me, even though, you know, you weren't allowed to have a difference of opinion during that pandemic, which was just crazy. But I guess the best place to start would be, you're an epidemiologist, I believe. You're a research epidemiologist. Is that correct? What do they research and study, for those people that don't know?
So I've been a professional academic for the last 20 some years, 23, 25 years. My formal training is in economics, and I have an MD, so I'm a medical doctor. But I've been writing about infectious disease epidemiology since almost at the beginning of my professional career. First on HIV, I've written on H1N1 flu, I've written on antibiotic resistant, a whole bunch of like classic policy questions in epidemiology, infectious disease epidemiology. I've studied lots of other areas as well, but like that's one of my major focuses. During the pandemic, I was drawn to studying the pandemic because of that experience in publishing in epidemiology. I formed hypotheses about how widespread the disease was early in the pandemic. Informed again by my previous interest in swine flu, for instance. I ran a study very early in the pandemic measuring antibody levels in the population here in Santa Clara County, California, where we found like there were 40 or 50 times more cases or people with evidence of previous infections than had been identified by the authorities, suggesting that the lockdowns in California anyways had failed early in the pandemic. So it's that work that I'd done in the past was the basis for the scientific work and also for the policy work that I've done during the pandemic.
Why does this work in particular interest you the most?
Well, I think infectious disease is one of these things where you would, for most of human history, it was the most important health problem people were concerned themselves about. I find that fascinating. And one of the biggest success stories of the 20th century was especially in developing countries, the conquering of that threat. With tools like vaccines, that actually, I think, provided a tremendous benefit to the poor. It was the poor that faced the biggest harm from these infectious diseases in the past. The development of antibiotics, the development of these these kind of technologies that essentially democratize the ability to survive into old age. I just, for someone who studies policy, who studies economics, who studies medicine, it's like catnip. All kinds of really, really interesting, interesting phenomena. The other thing that's interesting is that, is the way that people react to it. We economists like to think about the world as if everyone is rational. I do calculation and I optimize and I find, but no, when you study infectious disease epidemiology, what you learn very quickly is that rationality very quickly goes out the window. People are scared, like as we're built, our psychologies, our very brains are built to fear these diseases, to fear contagion. And you can think about human history and the development of civilization as a sort of like a structural way to contain that fear, to allow us to be in community with one another, even though we have in our lizard brains this fear that we're all going to get infected by one another. It goes back to the ancient times. So it's almost, I don't know how anyone can't want to study this. It's just super interesting.
I find human beings fascinating, how we respond to infectious diseases. I'm also relatively interested in how infectious diseases play an enormous role in life. Let's say that, especially considering COVID was not that long ago. And when the pandemic first hit, I'm going, oh, this is going to be nothing. Believe it or not, that was my initial thought. And then I started watching as human beings were so scared, so afraid really quickly. It was so heightened, mainly because of, I guess, fear-mongering of the news and not knowing as much as we do now about the actual disease. All we knew was there's this virus that came out of China and then it's just starting to spread around the world and everyone's going, oh, what do we do now? So I think it's really fascinating how human beings over history as well have dealt with infectious diseases in rather interesting and curious ways. I'm sure you've studied it. So are you able to share some of before vaccines were even in the picture, what were some of the things that human beings actually did with certain diseases, like the Spanish flu being one of them, and even some before that?
Let's go back further. I'll just tell you one story that I think is true, from a book that I read by this man named Charles Mann, who studied he wrote a book called 1491, which anyone who's listening should go read immediately. The book is a retelling of what happened when Christopher Columbus arrived in the New World.
Yep.
And there's archaeological evidence that he describes, suggesting that the New World, the Americas, was teeming with people, millions upon millions of people. North America, South America, it was huge, vast civilizations. We already have hints of this, of the Mayans, the Aztecs, vast civilizations of people. When Columbus arrived, he brought with him not just his ships, but also smallpox, a disease that had not been introduced into the Americas at all. You had this vast population that was entirely immune naive. And within 100 years of that introduction of that new disease to this immune naive population, 95% of the population had been dead, was dead. Just the population decimated, civilizations destroyed by this one infectious disease, to which there was almost no defense because the population was immune naive. Now, smallpox was endemic in Europe. This was before the vaccines. It was before any inoculation at all. It's 1491. The development of the cowpox as a way to sort of address smallpox or the vaccines were centuries away. And yet smallpox didn't decimate Europe, didn't decimate Asia. It's because of immunity. Right. Over centuries, the exposure of peoples in these now, of course, it still caused death and it caused destruction, but it didn't decimate 95% of the population the way it did in the Americas. You can see in that little story, that world changing story, what power these little viruses have. they shape human life. They shape the course of civilizations and have throughout history. In modern times, the development of vaccines and of the germ theory and of antibiotics have allowed us to have some control, but not over these agents, but not nearly as much as we think.
Do we know?
Right? So,
sorry, continue.
Oh, sorry, Jay. Yeah. So, I mean, like you asked about 1918 and the swine flu. That's a fantastic example, right? That 1918 is at the tail end of a catastrophic war in Europe. The huge populations of people again are impoverished. They're like large crowded camps in the United States of soldiers returning from that war or preparing to go to that war, living in relatively poor conditions. And it's a flu virus. Generally, the flu virus doesn't have nearly the same kind of effect. But in 1918, in those conditions, in part because it was a virus that was meeting an immune naive population for that particular variant of the flu, it sweeps all through the United States, sweeps the earth, in fact, causing tremendous death, especially in high numbers to young people. And the U.S. responds to it, sort of in a varied way. Like we didn't have the vaccine, we didn't have any treatments. What we did have was sort of common sense approaches to fluids and sort of trying to maintain like a healthy lifestyles. We also had some places closed schools for a little while. They couldn't do it forever because it was 1918 and there's no Zoom school. There's some places tried quarantines. It really, some places tried masks. In fact, masks were a very common thing in 1918 in San Francisco. There was, in fact, so common that a anti-mask league developed in protest masks in 1918. And scientists that were looking at this afterwards basically they concluded that none of that stuff worked. Disease just had its way. For a century after that, we didn't try that kind of approach to respiratory virus pandemics. For a century after that, the way we managed respiratory virus pandemics was focused protection of vulnerable people. Try to control the spread amongst the people that we knew would be most harmed by it. Generally, for these respiratory viruses, tends to be older people. We are so scared, of course, that another virus like the 1918 flu will come around that will preferentially harm young people, but it didn't. Not really. The other viruses came that harm young people, HIV and polio and so on, but no respiratory virus like this. And so we protected older people as best we could, and we developed the wisdom that if we disrupt society, we will end up harming the health of people much more than we will protect people from the disease that we're trying to protect against. And so, when the respiratory virus pandemics happened, like in the 50s and the 60s and the 70s, as recently as 2009, the H1N1 swine flu, we didn't lock down. We developed countermeasures as best we could. We now have vaccines available. We devoted all of our efforts to protection of vulnerable older people until the development of countermeasures. But we also had adopted this idea that public health should never panic people. You mentioned earlier the fear that was such a departure in 2020 from how I had grown accustomed to how public health would behave. In my view, the use of public health authority to induce fear is a deeply unethical thing, and yet public health authorities did that during this pandemic. The wisdom of generations was that you don't do that because you're going to cause more harm than good. And I think we've seen how true that wisdom was during this pandemic when we violated it.
We'll get to all that in just a moment, I promise you. But I wanted to ask you this. I grew up watching this show. My dad would have it on repeat. It was actually about history. And one of the TV episodes was about cholera. and I believe it was in England, and there was a guy named Bazalgette. And I'm not sure if you're able to share that story, if you remember it at all, because from my mind, I've got bits and pieces that are floating around, but cholera, is that still around today? And why was it such a big deal back then? And my other question in all that is, do we know the worst possible disease that has been in history?
So the history of cholera. Let me share just a brief bit about that. What cholera is and what is such a bad disease, right? So it's a disease that essentially causes diarrhea, intestinal problems. It actually causes death at very, very high rates if untreated or unmanaged. The main way it causes death is by dehydration. Essentially, you lose so many fluids from the intestinal effects of cholera, that you just can't. You die from dehydration. It's still a leading cause of death in children worldwide.
Wow.
Actually there are you can treat it if you have no money by a salt solution. A 5-cent packet of salt put in good water can rehydrate a kid, and then they won't die from it. And yet countless children die from cholera. Over the centuries, cholera in epidemiological epidemiology has been a very, very important disease, in part because there's a very famous incident involving a man named John Snow, and I'm now blanking on the date, but I think it was like 18th century.
Not from Game of Thrones, right?
Not from Game of John, right? I guess he lived in the frozen north, if you think of England that way, but whatever. So he's kind of so if you just picture the time, it's London. It's like the Enlightenment is happening in London. Like people it's a really heady time for scientists and epidemiologists. And this is a man who likes to go around and collecting data. So he's a man after my own heart. And now when the cholera outbreak happens in London, people are scared, right? The poor can't leave, but like the rich can leave the city if they need to. The reigning theory is that cholera is caused by bad air.
Miasma.
Sewage. Yeah, miasma. That's a miasma theory. And so, and there's like a big industry that grows up around removing like pollution so that bad air doesn't happen. Just imagine like these firms that are convinced they are the science of the day, and they go around saying if you just need to invest trillions or whatever the denomination was back then. It wouldn't be trillions then, millions maybe. And if you just invest, we can get rid of cholera from this. So Snow, what he has an idea that cholera is spread by water sources. He conducts this study where, he just like looks and just draws a map of London and goes around from house to house asking if you had cholera. And just puts little X's. Every house that has cholera, he puts it on the map. And he finds this like cluster of cases around a single pump in Broad Street in London. Broad Street pump goes and like, and he says, look, I don't know what's going on, but it's really clear that whoever's getting water from this pump that's who's getting cholera. And people that aren't getting water from this pump aren't getting cholera. So he says, well, just close this pump down and the cholera pandemic, this little outbreak of cholera will go away. And, they do it and it works. They don't need to like clear out the bad air, need to make it's good to make London not have sewage running through the streets or whatever. But that wasn't the key to ending that cholera outbreak. The key was identifying the source of cholera. Cholera is it's basically fecal oral transmission. So if you put contaminated feces in the water, which that pump had, and then you drink it, you are going to get cholera. You're likely to get cholera. And no, they didn't know all that then. They just knew that this people who drank from that pump were getting cholera. So it's actually interesting. Like, he was attacked viciously by the medical establishment. The Lancet wrote nasty pieces about him. He didn't really have a big impact in his lifetime, but afterwards people realized his genius. What he discovered was focused protection. Right? You focus your attention on the places in epidemiology where it will likely do the most good. And you don't try to do because if you try to like solve every problem all at once, you'll solve no problem. By a better understanding the nature of the problem, how is this disease transmitted, collecting data carefully and analyzing it with an open mind, he came to a conclusion that was absolutely correct. He's seen as the father of epidemiology.
Wow. So I remember the name of the show. It was Seven Wonders of the Industrial World, I believe it is. And the reason why I remember Bazalgette, was he the designer for all the sewer systems? I think it was, because they ended up, because of snow and trying to get rid of all the, the bad air, as it were, they also came up with these major sewer systems because bad water as well. Am I getting that correct? Or
I don't know Bazalgette. No, this is my ignorance not knowing this history. If he was part, I mean, if I'm trying to like a vague memory of him, but like my understanding, he was an engineer, and that he did design sewage systems. So in that sense, he would have been an opponent of Jon Snow, I guess. But these were both. I mean, like, he's actually, I think, if I'm not mistaken, remembered as a pioneer in public health, and appropriately so, because the kind of sanitation interventions that we've done over the last couple of centuries have had a tremendous effect in addressing the spread of infectious diseases. Tremendously, they've had probably much more. In fact, there's certainly more effect in almost any doctor than doctors have. Right. So the best public health workers to this day are trash people who take care of trash, who are responsible for cleaning your water. Right. That's who actually delivers public health to you.
How did Jon Snow die?
I don't remember. I don't know. Don't remember. I'm a very bad historian. You can probably tell, Jay. I have some impressions, and I remember some stories, but why don't we find out? Let's find out.
Let's find out together. I'm testing your memory here, Jay. Sorry about that.
No, it's.
I just think it's fascinating. Like, if we go back to the source, if Jon Snow is the father of epidemiology and he was warning people about a really dangerous infectious disease that was not airborne, but it was borne through water and people were drinking. I think in the BBC documentary, Bazalgette finds an eel, I think it is, and they were saying he actually admits that Snow was right all along. It wasn't airborne, and the sewer systems, they weren't necessarily that beneficial or that great. If we just looked at the water supply and where it was coming from and having a clean water supply, he admitted he was wrong. And he spent all this time, all this money focused on the wrong thing in the wrong area. And as a result, they ended up getting these amazing sewer systems in London.
Well, there's an irony there, right? So he was wrong about cholera, but he did an intervention that had tremendous other benefits. Snow was right about cholera. I just looked it up, by the way. Snow died doing research on anesthetics. She was like exposed to like coliform. I mean, just like all these like nasty chemicals. He died doing research. He died.
Poor bugger.
I know. Well, like you gotta be willing to like sacrifice for your craft.
Yeah, taking all the risks, right? I mean, have you ever been exposed to any of these nasty illnesses along your research?
Well, I am a research scientist. I don't see patients. I did when I went to medical school. I did see patients. As a medical student does.
Yep.
So I did a rotation in India, for instance, where I was exposed to leprosy. patients with leprosy. I've been in rooms with tuberculosis patients, again, all while I was in medical school. I have to say, like, the kind of research I do, it involves data analysis. So the most risky thing nowadays that I face is like too much sedentary time, rather than anything like Jon Snow faced, where he's walking around London facing, bad air, I guess.
Disease of boredom.
Yeah. Well, I mean, like, it is still pretty exciting. I mean, like, you study a data set and you have some insight into how diseases spread, what you might be able to do to fix things, what you learn, you learn the two things that people didn't understand were causally related to each other, are causally related. You think about the side effects of interventions in ways that people didn't understand before, and you potentially can change the world. So it's not like I don't regret. The thing is that you have to go where your insights are and where your talents are. And I like math. I like statistics. I like this I like these epidemiological and economic models. And I think that's where I've always thought as my comparative advantage. So I have to go there. I mean, God forbid if my comparative advantage was like, I don't know, studying chloroform, I'd probably dead of chloroform poisoning by now.
All the risks involved with that. My goodness. Yeah. I mean, it's funny because growing up, I wasn't that interested in science. I hated math. I didn't do well in science at all. And the older I get, the more interested I am in all this stuff, diseases, how things work. I've found that my brain has evolved quite effectively, I think, over a period of time. And I was like kicking myself not that long ago going, Jay, you wasted so much time as a kid hating on this stuff. You should have been interested in it, because if you only knew what you'd be doing later on in life, you'd be more interested and more fascinated. You'd sit down and actually focus a lot harder.
You're a young man. You still have plenty of time left. I would not regret any of that. I'm sure you'll bring interesting insights as a result of whatever you spent your youth doing.
I certainly try. I mean, I was more of a history nerd and history buff, but it's funny. I tend to forget a lot of history related material now, and I tend to remember more science and math related stuff. Maybe my brain has shifted. I don't know. It's weird.
Well, I think that bridging of those two kinds of cultures it's a really powerful thing. Like, I think one of the major problems I've seen during this pandemic is you see the technically minded person who can develop a sophisticated mathematical model with certain assumptions about the way people behave, but they don't really understand how people behave. They don't even understand that they don't understand. And they run their model. It looks like science, looks like really interesting, but they have no sense of how the interventions that they're modeling, when implemented in the real world, will have effects far outside of the things that the narrow set of things they've considered. I think interjecting history and humanities into scientific discussions actually has a tremendously positive effect. It keeps us humble. It reminds us that there's more to life than the models that we're looking at.
I think they both play they're symbiotic, right? You need history in order to be able to understand certain elements, especially when it comes to the present day. If we've got a virus today, we can look at all the mistakes of the past generations and look at what they did and what they did wrong or what they did right. And then we can transfer that into, I guess, present day and see whether or not that would work, but also come up with new solutions and use our brains more effectively, let's say, and common sense and rationale to move things along a lot better. And we've also got technology now to help us out, or it should be used to help us out, right? I think it's just how we've got to merge them both together and use them both to effectively make a better society and learn. And hopefully we do learn from the past.
Yeah, I mean, there's a human aspect to every science. It's done by humans, and of course the products of science, including the knowledge, are knowledge of humans, products that humans use, people use, right? So it's not like people sometimes think of science as like this, like the way that Spock on Star Trek, the Vulcan, emotional, and exactly that guy. But science isn't like that. Like it's not. It's filled with emotion and drama, and its power stems from that. Even on Star Trek, the whole reason why Spock was interesting was that he actually wasn't emotional. Right? You could see, he's half human. That's supposed to be a weakness. He considers it a weakness, but it's not a weakness, right? It's his great strength, and this makes him an interesting character. I think science is like that. Like science, there's no like platonic ideal of science outside of how humans use it, how humans engage in it. There's human stories all across it. If you forget that, you're gonna essentially undercut the power of science, or and probably this is even more dangerous, misuse it in ways that harm people.
I want to go back a little bit and ask you: do we know what in history has been the worst ever recorded disease? And then,
I'd say smallpox.
Smallpox.
There's no question. I mean, it's throughout history. I mean, hundreds of millions of people. It wouldn't surprise me to kill, on the order of hundreds of millions of people. It's gone. It's the most. It's the only human infectious disease that we've intentionally eradicated.
Wow.
And it took a century for us to do it. It's only recently, like I think 1979 was the last case of smallpox ever recorded on Earth. And it took a century of effort with fantastic vaccine. The man I think most responsible in the 20th century for its eradication is a man named Donald Henderson, who's I think the 20th century's best epidemiologist, and certainly on par with John Snow. As a tremendous figure, a towering figure in epidemiology. He helped organize the world response to smallpox. And, basically the tools were vaccinations, but then toward the end, when the outbreaks were happening in places where there wasn't, remote areas of the world where there wasn't vaccination coverage, in the midst of wars, he would try to negotiate with countries to try to get teams sent in. They had a strategy of whenever they would identify a local case, they would fly in, vaccinate the person, all the family members, people, other contacts. They use techniques that actually are pretty effective for smallpox, ring vaccination, but contact tracing, all these tools that are very effective in smallpox. And they even also quarantine, of course, the person who had smallpox, right? It turns out, and so but applied in a focused way on the set of people that were getting smallpox locally, not a global, let's shut down the whole world until smallpox disappears. It's interesting in history to see these themes come up over and over again. Sometimes they're applied wisely, and they result in fantastic outcomes like the eradication of smallpox. And sometimes they, like during COVID, they're not applied so wisely.
Yes. Well, I promise we will get into that, but I wanted to ask you before. I know we keep sort of alluding to the whole COVID thing. We're getting there. How does Christianity, more specifically, or I guess the idea of spirituality, how does that play into epidemiology and science as a whole?
That's a complicated question, Jay. I think, I think we live now in an age where that has this false idea that faith and science are at odds with one another. That if you have faith in that there is a creator God, that automatically makes you unable to reason scientifically. Mm-hmm. That idea is ahistorical. In fact, if you look at the Enlightenment, it comes out of a place where faith is like it's like water, it's how everybody thinks and acts, including the most important and prominent scientists of the age. People like Isaac Newton, for instance, he was very much driven by his Christianity. Mm-hmm. Blaise Pascal in France. If you go down through the list of people who sort of made modern science, like the progenitors of modern science, for them, faith was a tremendously important part of it. I mean, and a part of it has to do with, there's a philosophical thing, right? So if I'm to do science, the purpose of science is for me to understand the order of the material universe. Well, how can I have any faith at all that I'm capable of understanding material universe? It's a complicated thing. It's so complicated that maybe it's possible, maybe no human can understand it. That's one response to this complicated reality we face. It takes faith to say, look, if the universe was created by a creator who has a mind and has an order and isn't trying to trick us, right? That's, for instance, what a Christian might think. Then it's possible for me to apply my reason, who's also created by that same creator, to understand the universe. So faith then plays a symbiotic role with the goal of and the actions of science. Our actions, because we're made by a creator that isn't unreasonable, isn't like trying to trick us, that makes us so that we can also reason. So then that means that we are capable of using methods, scientific methods, to understand what the universe is going to be, or else otherwise just doing science at an impossible task. You need some faith that my actions as a scientist are going to lead to understanding in order to do science at all, I think. And so it's not surprising that the history of science starts in places where this faith is actually, is quite strong.
It's also, for me, when I think about it, trying to understand reason and rationale as a concept. And I'm going, if I'm trying to understand both of those things, where in the world do they come from? How in the world are humans able to reason rationally, for example, with another human being? And when we're talking about science, I think both of them have got to exist. You can't just have science and just say science exists, but reason and rationale does not. So yeah, I think
really go ahead.
I was just, yeah, you can go. I think you're going to say something more interesting than me.
I doubt it, Jay, but because you were on a roll. But I got to say, so like one of the things that has always puzzled me about this idea that science and reason, that science and faith were at odds. So for instance, like let's just ask what science is, like the premise of science, right? The premise of science is that when I'm studying a material phenomenon, I'm not allowed, and this is an axiom of science, I'm not allowed to make recourse to non-material phenomena. I can't just say there are like these gremlins pulling down on your shoes and that's why gravity works, or your feet, right? Yeah. That's a non-material phenomenon, unobservable, unfalsifiable. It's not science. And that's an axiom. When I make a scientific claim, I have to start from physical axioms, material axioms, not non-material ones. Okay, well, I think that's reasonable. It's an incredibly powerful technique of understanding the world. It's produced all kinds of leaps in our understanding of how the material world works, and resulted in all kinds of technologies that we find tremendously useful, couldn't do without. Vaccines among them. But can you use that system then to conclude that there are no such things, that they're only material reality, that there is no non-material reality? Can you, for instance, use it to prove that we have no soul? Mm. Well, no, because you started with the axiom that there is only material explanations. That axiom produces science, tremendously useful. Yeah. But if you had a different axiom, you might lead to different conclusions. You can't use that axiomatic system that excludes non-material causes to then conclude that there are no non-material causes. So it's a category error to say that science excludes faith. Science in its own realm is tremendously powerful, but it doesn't say that there are no non-material causes. It assumes that there aren't, but it doesn't. So you can't thereby conclude that there aren't. It's like you're essentially assuming the conclusion when you say that. Mm-hmm. Whereas, so what that means is that I'm not saying you necessarily have to be faithful or believe in a creator, but there isn't anything in science that says there isn't a creator. And conversely, I very strongly believe that faith, properly understood, allows science to exist. Because if I have this faith, all scientists have it. Like, all scientists believe that their work is going to produce a better understanding of ordered reality. If they thought reality was so unordered that their work wouldn't produce it, well, then why are they doing science in the first place?
Yeah.
So that's what I mean by it's a symbiotic relationship, not a antagonistic one, as we've heard, I think, countless times in the recent decades.
Well, I look at it from this point of view as well, just going along with what you were saying, which I think is brilliant. How would you go about proving in a tangible setting a person's soul? How would you showcase that to anyone without the faith element to it, without the belief that this is in fact real? If you're not allowed to question that, which is fundamentally the role of science, to be able to question things and to learn and to figure things out. If you're just going, I'm a scientist, but soul doesn't exist because I don't have tangible proof, then you're not really a scientist, because you've just said that this in fact is not actually real, and you haven't dug a little deeper. You haven't asked any further questions. So when I've seen, you've got these evolutionary biologists and, these atheists that come out and say that God doesn't exist because science claims it doesn't exist. We don't have any tangible proof or any evidence. Well, how do you know? Like, what is your reason behind you, in fact, saying that it doesn't exist? It just, to me, that it's not really doing effective science, in my opinion. It's like they're denying real science in that case. That's my viewpoint.
I think that's an interesting idea. So, like, the idea, it reminds me of this principle in science, right? So if you want in science to prove the lack of existence of something, like you want to prove that something doesn't exist, you're going to have a hard time in science, right? It doesn't exist until you identify, until someone finds it, right? You can say, oh, well, my theory implies that this thing doesn't exist. But that doesn't mean how do you know your theory is right? There's not, if the theory is wrong, the thing could exist, right? So I'll give you examples of this in science. In the science of genetics, genetic crossover, genes that crossover in meiosis, that idea, before it was known, the idea was that you couldn't have, if two Drosophila flies mate, and would they have red and curly wings, and one other has like I don't know, black eyes and red eyes and black curly wings, and other eyes like black eyes and straight wings, that they would that their kids would inherit the traits together, or rather independently. And yet often you see traits inherited together, and very rarely you see like crossover events that would then break that bond. It's a very famous result in genetics that the very rare crossover event was discovered by a fly that shouldn't have been there if the old theory was right. So what am I getting at? I'm getting at that the non-existence of something, a soul or something, if you have a theory that says that it can't exist, that's not the same thing as proving it doesn't exist.
Yeah.
Much easier in science to prove something exists than to prove something doesn't exist. You prove it exists by showing it. Like here it is. But the question then is like, okay, by an atheist or someone might be to a theist, say, look, prove that a soul exists. But so now the question is, how should the proof go about? Right? It's not enough to say that I can't. I'm not allowed to prove. I can't prove that it doesn't exist using scientific methods, because science isn't built for proving non-existence. I want proof before I believe, right? Then I have to say, like, okay, well, now we're not talking about science. science has as an axiom that there is no non-material causes. A soul is a non-material cause if there is one, right? And so I'm not going to be able to use scientific proof to prove something that science excludes as an axiom. I'm also not going to be able to use science to prove that it doesn't exist. If a soul exists or doesn't exist, we're going to have to discuss it using other methods.
Which I think that there comes the theological debate, doesn't it? In that instance.
Well, I mean, that's then you have to say, okay, what do you mean by other methods?
Yeah.
How can I know that there are not some non-material things? I'd say I think we all really know. We all really do know. So why do I love my mother and my father? Why would I sacrifice myself for someone else, even if I don't know them? Why do I give to charity? Why do I act in why does my conscience tell me things that to do things that I think I ought to do, even though it's probably bad for me to do them in some narrow material sense? There are some deep mysteries, and you can have scientific theories to try to address at least parts of those mysteries, but you can't really get at the full of it. We all know that. So if we all know that, if you know that that's true, that must mean that there are non-material things that we have to reason about. And we may then need different methods and scientific methods to reason about those things.
Do you ever think that even if they were to prove it by science and hold it up tangibly, here is evidence that we've got a soul, do you still think that people would actually believe it or deny it anyway?
I don't think it's possible actually to prove it by science. So I guess I would argue with the premise. I mean, I agree with the atheists in that sense, that you can't actually use science to prove those things.
Yeah.
That it's a category error. I completely agree with that. I think, in fact, a lot of people who are faithful have, I think by trying to use science to prove something that it can't prove, have done harm to the cause of faith.
Yeah.
We've set ourselves on an impossible task. My view is that if you accept what science is, it's beautiful and worthwhile and powerful and in its own right, but it's not everything. And trying to pretend like it's everything is a mistake. At the same time, trying to and that mistake then impoverishes you. Now, atheist friends of mine will say, look, that's not true. I'm leading a full, happy life, and I don't disagree with them. They're leading a full, happy life. But I do believe that they are impoverished in ways that they can't recognize. Well, they won't agree with me because they're talking about, I'm talking about things that they don't believe exist. So, it's an impasse.
It's hard to, when you're speaking, I haven't actually had any atheists on the show before because I need to get up to speed, I guess, myself with everything that they believe in, so to speak. Although I've been rather interested in listening to Richard Dawkins and Christopher Hitchens just from the perspective of what they believe in and why they believe it, even though I believe rather differently to they do. I think it's just, for me, as trying to be an intellectual thinker and trying to use reason and rationale in my life, I can't just go, because God said so. I've got to be able to prove it in some way, shape, or form with a logical consensus. And I think before I would just go, you're wrong. Let's leave it at that. But now I'm going, well, why? Why would they be wrong? How can I show to others that they are in fact wrong? Let's have a conversation. So I need to get up to the speed with that. I don't think I'm smart enough yet.
Well, I don't know, Jay. I mean, I think I'm not particularly militaristic about this, and I don't believe that my mission is to go and disprove an atheist from the way. I mean, I think we are really, we're all in the same boat. We're face this very complicated reality, and let's go learn from each other. Let's reason with each other. You may reason from a different premise than me, but we hopefully, even though we reason from different premises, can learn things from each other. So my very favorite atheist is Friedrich Nietzsche. I think there's some bad history with how Nietzsche was used, but if you just take him at his word, his goal was to try to understand the source of our morality. You know, why do we believe in a society that that caring for the weak and the poor are a good thing. The examination he gave to that question led him to this idea that really it's Christian morals that have been imported over, that have put in place this idea that it's good to do charity for the poor, the weak. Yeah. And then he developed his own philosophical system, saying, well, what would a moral system look like if you didn't adopt this Christian idea of, you know, the meek shall inherit the earth, that the children are the most are valuable. You know, if you didn't adopt the sort of the key Christian moral ideas. This is apart from Christian religion. This is Christian morality, I think. But they're linked, but they're not. You could take one without the other in principle, I guess. I think in practice hard. But then now you have. But then he built up this entire system where if you jettison Christian morality, he replaces it with something he calls will to power. Right, this idea of like the self-made person creating their own moral structure. Essentially from brand new. It's a very dangerous idea, I think. But that kind of reasoning is tremendously honest, right? I like him because he's saying, let's ask what happens to our moral systems when we divorce ourselves from Christianity, which is what he wanted to do, which is what he did. Very famously said, God is dead. Yeah. Right. So if you believe that, then you have to ask, how should I be? How should I act? If theistic systems provide an answer, at least in part, like there's of course dispute among different theistic systems about that and a lot of reasoning, but like there's an answer that you can get from different theistic systems. Well, what is the answer to that question when you don't have that? And I think Nietzsche provides probably the most coherent answer to that. I find it particularly ugly, but that's me.
I just wanted
I love the honesty of it.
I do too. And I just want to clarify, like, I'm not out to disprove anybody at all. Like for me, I'm a very curious individual, but when it comes down to certain topics, I don't feel like I'm confident enough to go in and even have a debate. Let's say if it even got to that point, I want to ask as many questions as I possibly can to try and figure out why you believe in that side. Why are you an atheist to begin with? And then obviously go from there. But like I mentioned, I don't think I'm smart enough yet to do that. So maybe one day, Jay. Maybe one.
I don't know. I think these are one of these things where like you just have these conversations over a pint of beer or something, and you end up being great friends even though you disagree about everything.
Yeah, it doesn't need to be recorded at all. Like I think at the moment the camera turns on, everyone just shuts down. And it's like, oh no, that's there forever, or so to speak. But anyway, I'm really grateful for your work, Jay, and I'm really enjoying this conversation. I wanted to switch gears a little bit to the whole COVID stuff. Now, we could spend ages, and I mean ages, talking about this, but you're well known for going against the main sort of narrative, going against lockdowns. Would you be able to share why you went against lockdowns?
So it's primarily I'm motivated by two. So why has two multiple meanings? So I'll just tell you the proximate reason, which is it has to do with two scientific facts that we can go, but maybe deeper if you're interested into, like, you're asking me about my psychological state. I don't know, given the conversation the way it's gone. So from a scientific point of view, my analysis is based on two facts, and I think everybody agrees with these facts. There isn't a single person that disagrees. At least not a single reasonable person. Fact one, there's a very steep age gradient in the risk of bad outcomes from infection. Mm. Now it's true that young people and children can be harmed by this disease, but it's much, 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 much less likely than an old person. I did a study, as I said at the beginning of the conversation, of how widespread the disease was in Santa Clara County, California, in April of 2020. There's a similar study in April of 2020 in LA County. They all reached the same conclusion, that there's this very steep age gradient in mortality. And you find basically this everywhere. 80% of the deaths are people over the age of 65. Fact one. Fact two, the lockdowns are harmful. The lockdowns are harmful not just to the economic well-being of people, but also to the social well-being, the mental well-being, the physical well-being of people, and particularly for vulnerable people, for the poor, for the working class, for children. Lockdowns are a tremendous disaster. Right. So let's just focus on children. We, in many places, we closed schools for a very long time. And the evidence is coming out now that our children were harmed by this, where their learning is a year or more behind where it should be. And it's not like you can fix it. That time has passed. You can try to address it, and we should, but you're always going to have this. There's going to be a generational deficit for the kids that were in school, or I guess out of school during the pandemic. There's a social science literature that goes back decades that has documented the importance of continuous schooling during youth. If you skip school for even relatively short periods of time, it can have lifelong consequences where you lead shorter, poorer, less healthy lives. Mm-hmm. That's a well-documented social science literature. One estimate early in the pandemic, applying this literature to the U.S. lockdowns in March and April 2020 for the school closures, estimated that the U.S. cost our kids, 5.5 million life years. And it's worse in poor countries, like in Uganda. 4.5. They closed schools for 2 years on the basis of this crazy. Have to slow the spread by doing social distancing. They closed schools for 2 years. Many of those kids, tens of millions of kids, they had no school. It's not like they had Zoom school. They just had no school for 2 years. Mm. And 4.5 million of them never came back to school after 2 years away. We've created a generational inequality. We of course, we were already an unequal society before, but we've exploded that inequality and catapulted into the next generation in ways that are impossible to fathom. Like just the extent we knew it was coming. We knew we were doing, and we knew we were doing it at the time. The economic dislocation caused by lockdowns, according to an estimate by the World Bank in, I think, April or May 2020, was that we would send 100 million people into dire poverty, $2 a day or less of income. Well, what are the consequences of that? The health consequences of that are tremendous. Again, shorter, poorer lives. Yeah. So fact one, age gradient in mortality risk from COVID infection. Fact two, this huge ubiquitous harm from the lockdown. The right solution then is focus protection. Focus our efforts on the people that are highest risk from the disease, protecting them as best we can with the technologies we have, developing technologies as rapidly as we can to protect them better, older people. And for the rest of the populations, lift the lockdowns. Let them participate in society as they see fit. Don't panic them. Allow people to participate because it's more healthy for them to participate than to not. And even for the older population, the idea isn't to throw them in concentration camps. The idea is to allow them, give them the resources that they would need so that they can figure out how best to protect, to be protected. So just to give you some ideas, we included in the Great Barrington. This, by the way, is the Great Barrington Declaration I've just described to you. Some ideas we gave in the declaration. We organized societies, developed societies to deliver food for free for well-off young people, Uber Eats or whatever. Why not organize societies to deliver food for free during times of high spread to older people? Give sabbatical pay so that older workers don't have to work when there's high spread of the disease. sick pay so that people can stay at home. Poor people can stay at home when they're not feel forced to go to work when they're sick. Why not use our resources? This is before the vaccine, to protect older people. If we'd done that, for instance, in New York, for instance, the governor of New York in early 2020 sent COVID-infected patients into nursing homes. Why would he do that? Because focused protection wasn't his strategy. His strategy was protecting hospitals. So take patients out of hospitals, send them to the nursing homes. Makes perfect sense if your goal is protecting hospitals. Makes no sense if your goal is protecting people from dying from this disease. Right? So, and then after the vaccines came, very rapidly vaccinate the most vulnerable people everywhere on earth, no matter where they're found. Right? Because the vaccine, we can talk about the vaccine in a bit, but we knew enough about the vaccine in late 2020 to know that it was very likely to reduce the risk of mortality from this disease. So use it on the people who are most likely to die if they're infected. Right? Yeah. That seems like the most reasonable thing to do. Those were the ideas. That's what I was advocating through the whole pandemic.
The lockdowns, I don't know if you heard too much about what happened in Sydney. And then in Melbourne, Melbourne was literally named the most locked down state in the entire world. That is not a good thing to have on your resume. And now the people of Melbourne are actually paying for it quite significantly because the Premier, Dan Andrews, we call him Dictator Dan, decided to spend. And now all of the poor taxpayers are now having to repay all of what he had spended during that entire period of time. They don't have a great deal of money now because unemployment is at its highest in that particular state, mainly because no one wants to work anymore. No one wants to go back to work. And I think the lockdown considerably, let's, give all these people that are now quite out of work, let's give them all these payments as a relief. But who's actually paying for it all? It's the taxpayer now as well. So all these people are going, why should I need to go back to work? I'm just going to go off everybody else's that's actually going to work. I'm going to go off what the government's giving me. But it doesn't work like that. And now the mental health side of things is another issue. Kids are losing social skills. They're depressed. They're miserable. I don't even know what in the world they were thinking at the time. I think they were just going, the first lockdown was like, I think I was a little bit naive, right? Fair enough. We need to try and stop the spread, but we didn't stop the spread. It kept going, even though there weren't so many people out and about. And I was going, what's happening here? It's like, if there's no one really out and about, why is the disease spreading like wildfire? They're telling us, wash our hands, social distance. I mean, social distancing is an infamous term now, right, Jay? And then mask up. They were telling us that masking was really, really effective. But even when you did mask up, you still got the disease. So it wasn't effective. And now the media is going, the ones that said that we're anti-maskers or anti-vaxxers and all those sort of deal, now the media is going along with it. And it's all changed. And I'm going on a little bit of a tangent here.
No, I think the Australian experience is so interesting. So I actually had the privilege of visiting Melbourne and Sydney last summer, and I wandered around the Melbourne CBD. They actually had little stickers in 2022 encouraging people to come back to the CBD because all of the stores that had closed down because of the loss of business. 270 days, I think, of lockdown in Melbourne.
Nuts.
Where you weren't even allowed to go outside for more than, you could go for like an hour or something for exercise in an hour. And if you were seen with someone else, you could be arrested. I saw a video from Sydney where they were essentially beating young children who weren't masked, the police. It was just a brutal application of police power to impose lockdowns. But it's okay. So I want to the Australian experience is so different than the American experience. I think it's worth just giving you my just a few minutes of my views. So, because I think if you go through this, so the lockdowns in the U.S. utterly failed to stop the disease spread. Right, that we locked down in the middle of March 2020, the disease still spreads. Huge waves of cases in that spring. Then more cases, waves of cases in other places that are locked down in the spring, in the summer in the South. And then again in the winter, 2020, a huge set of 2020-21, a huge wave of cases, right? The lockdowns, if thought of them as like stopping the disease from going, or making the disease go away, it didn't work in 2020. Australia had either the fortune or misfortune, I don't know how you want to characterize it, of when the disease arrived in March of 2020 to Australia. So let's say March, or probably a little earlier, probably arrived, but like let's say March 2020. You were in your summer. We were in our winter. The disease spreads more easily in the winter than it does in the summer. When you locked down in March 2020, it probably did stamp the disease out. It hadn't really spread very far, and it was, the atmospheric conditions were such that it wasn't going to spread very easily. So it looked like in the summer of 2020 that Australia had done the right thing. It had locked down hard and gotten rid of the disease. I still remember writing to some Australian colleagues who were triumphantly saying, "Jay, why are you against lockdowns? It worked here. We have a normal life here." You're laughing, I can tell, Jay, because I have to set this up with like the right. I think this is what happened, right?
Yeah.
Please correct me. I wasn't living in Australia at the time. I was an outsider looking in.
No, you're right. You're right.
And then the disease came back to Australia. You close international borders so that even people who were expats living outside of Australia couldn't go back home to bury their family members that died. If you did manage to come back, you'd have to have, like in New Zealand, you had a lottery. You weren't only, if you did manage to come back, it would cost you, from the United States, $10,000 for a flight. And then you'd have to sit in a hotel room for 2 weeks while you quarantined to be negative. I even saw stories where people weren't allowed to cross, from Sydney to Melbourne to go be with family. Right. So that internal travel was closed down. Whenever there was a single case, you would get this tremendous lockdown. Dan Andrews, I remember watching some of his video, his like press conference. He just looked like he was a man on a mission, right? And the only thing that mattered to him was COVID. Can't let a single COVID case into this. And when there's one, you want to root it out. And anyone who got COVID was like, like a social miscreant, like a bad guy. I remember this one video, I think it was out of Australia, this quarantine. This person who was in quarantine, he was in this elevator escaping, and it was like an all points bulletin to like go find the guy that had escaped.
You're a criminal.
Yeah, I think literally, right? Yeah. You had this like draconian lockdown that had caused all the harms you're talking about. People died at home with heart attacks in Australia. People died. The mental health consequences. I have personal friends whose children committed suicide in Australia, right? The mental health consequences. It happened in the U.S. too, by the way. This is not I don't mean to say Australia is unique in this. Wherever lockdowns happen, that happens. It causes depression, it causes anxiety, it causes deep mental health problems. It leads to drug overdoses, a whole kinds of other pathologies, and that happened in Australia, right? And then the vaccine arrives. The whole goal of the lockdown strategy, if you're going to make a case for it, was to get to a place where we have an effective technology to protect you against the disease. Now you have one, but this arrives in December 2020. The Australian government and the provincial governments, they spend the next 9 months messing around trying to get the contracts in place with almost no urgency whatsoever to get the vaccine. And in a way, it was like the success of zero COVID in 2020 that led to this lackadaisical attitude toward the vaccine. Well, what do you need a vaccine for if the disease is not here, right? But the entire Australian population is immune naive.
Mm.
The disease hasn't spread. It's not like in the U.S. or Europe or Latin America, where the disease is spread. And now you don't have an immune naive population. You have a lot of people who've seen the disease and recovered. You now have a lot more vaccinated people, especially starting in December 2020. Instead, the Australian government just sat there, and during that time, you had lockdown after lockdown after lockdown, because you can't stop the disease from spreading. You cannot, even if you're an island in the South Pacific, you can't stop the disease from spreading. It's going to come back. You have to like close yourself away like a bubble boy forever if you want to not ever get this disease. It's not possible. And you're multiplying the economic and other damage from the lockdown hundreds of days, long after the vaccine became available. What excuse was there for that? Why not buy enough vaccine doses to protect all the older people that you can, and then buy more for people who voluntarily would want that are younger because they're scared, and then open up? That could have happened. You could have been open by February 2021.
We could have been.
Yeah. And then Omicron hits. And whatever possibility there was of stopping the disease, it becomes laughable. It's obviously not possible at all anymore. And the policy shifts overnight without any notice from the government that, oops, we were wrong. Oh, sorry, we made this mistake. No, that's just all of a sudden it went from one case leads to dozens of days of lockdown, draconian lockdown, people locked in their apartment buildings, to, well, okay, we're done. No, we're just not going to talk about it. Right? I think that is my view, at least, and this is an outsider view, so you please correct me, Jay, if I'm wrong, but that was my view of the Australian policy. Seems like a failure, basically on every front.
And if you look at nail on the head.
Yeah, I mean, and if you look at if you compare all-cause excess deaths throughout the pandemic in Australia versus Sweden, which followed a much more reasonable policy, I think, no lockdowns. They kept schools open for everyone under 16 through the whole pandemic, basically. No forced school closures, no business closures, churches were allowed to meet, so on. Their all-cause excess deaths through the pandemic are lower than Australia and have been, I think, since the middle of 2021. Mm. I actually represented a church a synagogue in Sydney. I think it was in 2020. I think, yeah, it was 2021. And the synagogue, they wanted to celebrate High Holy Days. I was an expert witness in the case. And what they wanted to do is they wanted to blow the like that horn, I don't know what it's called, the shofar or something. Yeah. It's part of their religious celebration that they do. And public health told public health they're going to hold this ceremony. It was a very, very, very important and meaningful ceremony for religious Jews. And the public health told them, no, you're not allowed to do this. Well, they said, okay, well, I'll tell you what, the disease doesn't really spread outside. We'll hold the thing outside. No, you can't do it. We'll make sure that everyone is social distance, 10 feet away, and wearing masks. No, you can't do it. They're bending over backwards to be able to appease public health, but public health says, no, you can't worship in the way that's meaningful to you, that's important to you. I mean, it's a fundamental right of free peoples to be able to worship freely. Mm. And yet the government of Australia is saying, no, you can't do it in the guise of public health. The lawsuit goes to the High Court in Sydney, and they wouldn't even listen to my testimony about the relative safety of doing this in these conditions. And the judge says to the synagogue and this religious community, the Jewish religious community, that if public health says it's dangerous, then you don't have freedom of religion. That that the public health can abrogate those basic civil rights as it wants without having to justify itself in court with scientific facts or whatever. It can just do it. That, I think, unfortunately, is the state in Australia right now. The rights that you thought you had, freedom of movement, freedom of expression, freedom of religion, all of the most basic civil rights in Australia do not actually exist, in my view.
It was almost like this major test to see whether or not Australians would bow down, and they did quite significantly. And those that didn't were arrested, brutally charged, which a lot of them now have been thrown out of court. Surprise, surprise, because they go against human rights, and they were just stupid to begin with. Like, you're charging somebody for not wearing a mask, walking down the street outside, socially distancing. You arrest them, lock them up for weeks. I mean, there's some cases that I was seeing that was absolutely horrendous. In Sydney, the second lockdown, I mean, even the first lockdown, they shut down parks, of all things, thinking that the great outdoors, they shut down my outdoor workout equipment. I'm just going, well, stuff this, I'm still going to use it anyway. And the neighbors, one of them filmed me and was going to dob me into the police. I ran after her and said, excuse me, why in the world are you filming me without my permission? And she got all scared because A, I wasn't socially distancing. B, I wasn't wearing a mask. She was. She got all irate at me. And I said, if you send this to the police, I will personally go down there with you. I will personally go there with you and tell the officer why I was doing nothing wrong. And then I don't even know what she did with the video. I didn't get in trouble then. But in my area specifically, they had these areas of concern, LGAs. You weren't allowed to go 5 kilometers outside. And if you did, there were police everywhere, Jay. I've seen more police during that period of time than I ever have in my entire life. No joke. So many police. If you went outside of your LGA of concern without a specific reason that was deemed acceptable by public health, only by public health, you would be charged. You get a fine of some description because you are contributing, even if you didn't have COVID, you're contributing to the spread. I'm just like, what on earth? They also, at the harshest point, you had a curfew of 9 p.m., I think it was, then 1 hour of exercise, which I'm just going, how in the world are you going to police that? That doesn't make any sense to me. What, is the cop going to ask you, how long have you been out here for? You say, 30 minutes, but you've really been out there for 2 hours. How's he going to know? Like, it didn't make any sense at all, but it all came down to, I love this power. I'm going to use this power on the vast majority of the population, but it didn't make any sense because people in the West paid for it considerably because they're the more religious side, I think it is, versus people out in the East, in the more richer suburbs. And then the people in the West are sort of the poorer demographic, right? People in the eastern suburbs, in actual Sydney, we looked at it, they've got a higher economic growth. They're vastly more wealthy than everybody else. They're less religious too. And there's like, everything was normal for them. I went out one time and I went over to Manly. I couldn't believe it. People were playing golf. People were out having a good old time. They're at the beach. It was as if COVID wasn't in their area. It was only situated in this one little group in the West. It is like it only decided to attack the West. I'm going, what in the world is happening here? It's discrimination. It was like the virus decided that it wanted to just go after this one little area in Sydney and not the other area. How about that? Going after the poor, but not the rich. It made zero sense to me. But that's the way it was. You couldn't say anything. You were shut down on social media. You were another individual was actually arrested at his home for saying something on social media. I'm going, what is happening to my country? What is happening to Australia?
Yeah.
And
if you didn't take the vaccine, you were an outcast.
The unvaccinated were the enemy.
Yeah. Well, I it's just to come back to this theme of inhumanity. I saw the New South Wales health officer, Kerry Chant, give a press conference where she was talking about what to do during the lockdowns, this crazy lockdown you guys were in. And she said, well, you may have to go grocery shopping. When you go grocery shopping and you see a friend at Aldi's, be sure not to say, don't look them in the eye. Don't say hello. Don't talk. I know you want to be friendly, but it's not friendly. Just do your business and get out. Do not talk to your neighbor. It's one of these things where like, who is she, right? To know that you should be isolated. Like, why does she get to decide for the entire population that talking to your neighbor, even in outdoor settings, might be dangerous? Why is not talking to your neighbor not part of human well-being? I just couldn't believe it. I mean, it's like public health officers shouldn't be talking to the population like that.
Again, Jay, it just came down to she was earning quite a bit of money during that time. She also had a great deal of power, so everyone would look up to her. There was Brad Hazard, Kerry Chant, and Gladys Berejiklian.
Hazard, I saw him give a press conference where he talked about like the invisible enemy. It could be the virus could be anywhere. It could be at the beach. It could be just you open the door and there it is getting you, right? Like this, creating this. You remember this one, Jay?
I do all too well.
So it's like, you listen to this guy. Look, you're a public health professional. You don't panic the population with this nonsense, right? You have to give people good advice about I didn't ever think that anyone should intentionally get infected. But I think what you want to do is focus your attention where it's going to do the most good. Don't panic people. Focus the attention on nursing home populations. It's complicated to protect them. You can't just isolate them because that's bad for their health too. Structure your response where it'll do good without causing panic. And I think that the Australian authorities really failed at that. We haven't even talked about the quarantine facilities in Queensland or something, or like Michael Gunner talking about vaccine mandates. It was truly shocking. By the way, I'm criticizing Australia. I have at least as harsh, if not more, criticism for American authorities who were. They just like in New York, they masked toddlers, 2-year-olds. For years.
Saw the video.
On the basis of no evidence.
Yeah.
What good is masking a toddler going to do? And what harm does it do to toddlers to be masked up? I mean, we're seeing kids with delayed language development as a result of this. Social anxieties. We should have been thinking about this during the pandemic. Instead, all our health authorities thought that the only health threat that mattered was COVID, rather than all of the other myriad health threats that we face as humans.
Yeah, we could spend ages talking about the vaccine mandates. I mean, we were forced to get it, sadly, and I was scared because I had adverse reaction to just normal vaccines when I was a baby. So I haven't been fully vaccinated because I had an allergic reaction. It would have killed me otherwise. So the doctor back then said to my parents, wisely, it's not a good idea to vaccinate Jay with all these other vaccines because he's had an allergic reaction, and if you do any more, it would more than likely kill him. So I've been okay ever since. And when it came down to your freedom, your job, or take the vaccine, I was going, you can't do that to people. I'm not an anti-vaxxer at all. I'm all about choice, but the choice was literally taken away. And now they're going, oh, we didn't force anybody. We didn't force anyone to do it. I'm going, you did. You gave everyone literally an alternative of their finances, which they're already in a dire position to supply for their family and provide, versus you get the jab and then you're not doing your bit for society. It's like emotional blackmail that was just at a heightened level, and anyone that didn't get it was perceived to be the enemy. Like, I got a vaccine exemption from a very wise doctor who was against all of the rubbish to begin with. I got the exemption, but that wasn't good enough. I had a mask exemption as well from my cardiologist because my heart is enlarged. I need to be able to breathe properly. The amount of looks that I got, Jay, if I walked down the street, is as if they wanted to bash me. I'm just going, I don't feel safe in my own suburb because of all the fear that had been created it was neighbor against neighbor. Like, if you're not doing your bit, if you're not following along, if you're not following the message of these so-called health professionals that couldn't keep their information straight 1 minute from the next, the goalpost kept on moving. And then the messaging, it was like a great marketing ploy. I kid you not. It was like, you get vaccinated, we're going to stop the spread. Everyone got vaccinated. The spread continued. I mean, everyone and then the messaging changed around that. It was absurd. Absolutely absurd. I know it happened in America as well, and certain states. New York was nuts. California, I know. Gavin Newsom. Like, where do these people get off? That's what I'm wondering. Like, what's going on through your brain? Seriously.
I mean, I think that's a complicated question. I do like it. I want to try to let's assume good faith on their part.
Mm.
It's hard, but I think it's worth to see. Okay, could you land at what they did with just pure good faith? So imagine you believe that this is a deadly virus. It is a deadly virus for certain, especially for older people, it's a deadly virus. You believe that you have a responsibility to protect your population from it. Right? They do. They have a responsibility to protect the population. That's part of their job. And so the thing is that there's stuff they don't know about the virus. They don't know. There's stuff that they don't really know about the interventions that they're doing, other than the fact that they're like violations of basic civil liberties. Right. So, you can imagine making a case saying, well, look, these were good faith efforts, excessive, but good faith efforts to try to protect the population. But the problem with that is that only goes so far. Right. So at some point, you cross over from, okay, I didn't know what I was doing and I just did this, and therefore, and I regret having done it, to let's keep doubling down, because if I admit that I was wrong now, people will think I was wrong all along.
Yeah.
And the health advisors, they're so narrow in their focus, right? So it's one thing to say, okay, I'm an infectious disease epidemiologist and I'm a professional that studies this, and here's what I can tell you about this disease. But don't ask me about the economic harms. Don't ask me about other health harms because I don't study them. You could say that, right? That would be a reasonable thing for an epidemiologist, an infectious disease epidemiologist, to say. But they didn't say that. They just said that you have to listen to me because I know infectious disease epidemiology or virology or immunology or whatever. And anyone else who has other expertise is not relevant to the question now. So I think that the good faith assumption of good faith, I think it buys you some mercy for them. But at some point they crossed the line, far past where their expertise was, into a place where it was just hubris. Only they knew how to stop the disease. Only they knew how people should live their lives. And it didn't matter basic protections in civil society for civil rights, none of that mattered.
Nope. And I know we could spend a lot longer, honestly, talking about all this stuff. Jay, I know you've been so gracious with your time. I feel bad for keeping you for so long. I know you've probably got so many more things to do in your day, but thank you so much for your willingness to talk about all this stuff and your courage as well. And I know that I put you on the spot with 1 or 2 questions. You've done an amazing job. Is there anything that you want to say to my audience, anywhere that they can go to learn more about you before we officially end?
So I'm weirdly active on Twitter, although before the pandemic, I never had a Twitter account. It's Dr. Dr. the letter J, Bhattacharya, Bhattacharya. And then, so Dr. J Bhattacharya on Twitter. And then I have a new podcast project called Illusion of Consensus. Oh. So if you go to, it's on Substack. So just just put my name and Illusion of Consensus and you'll find it. And we interview people, I'm doing this with a journalist, a young journalist named Rav Arora, who operates out of Vancouver, British Columbia. And so the goal there is to essentially to document the methods by which that governments and scientific organizations created an illusion that there was a consensus for these policies and other policies and related policies, when in fact there wasn't. Focuses on free speech rights. I know, in fact, I read that Australia is now considering a bill to limit free speech rights.
Yep. It's under Michelle Rowland, the communications officer. And I'm not happy about it at all. Not one bit.
This is a common thing that's happening throughout the world, right? That the governments have decided that they don't want to let these kinds of conversations happen freely, or at least not to be able to limit the reach of them. And yeah, as a result, what's happened is that the governments have used this power to protect outside criticism of their own misinformation. And it's I think a step backwards from the normal Western commitment to civil rights.
I agree with you on so many fronts. And we didn't even talk about what happened in Canada with Justin Trudeau, another dictator of sorts. And yeah, there's so many things. Perhaps we can have you back, Jay. We'd love to have.
Love that. It was really fun to talk with you. You asked me questions I didn't get. I've never gotten asked before. It was interesting to talk about.
Yes, that's what I aim, my friend. I really do. And we didn't even get to your testimony either. So we're definitely going to have to organize a part 2 to this conversation. But thank you so much for having a conversation with me for part 1.
Love to talk with you, Jay. Take care now.